Great.
Welcome. My name is Chris Alexander. I'm the librarian at the Saratoga Springs Public Library, and we're delighted that you can join us for today's program, Medicare 101, Understanding Your Choices. At this point, I'd like to introduce the speaker, Dave DeMarco. He's a Medicare counselor for New York State. He volunteers with the Saratoga County Office for the Aging. And he's quite knowledgeable about Medicare issues. He's presented for us before, and he's great. And he's going to provide an overview of the options so that you are able to make a better choice of your options. At this point, I'm going to turn it over to Dave.
Hi, good afternoon, everyone. Everybody hear me okay? Just give me a thumbs up if we're good. Great. Like Chris said, we'll probably do all the questions at the end, mostly for privacy reasons. We'll be recording up and before that. As you mentioned, I'm Dave DeMarco. I'm actually a volunteer for Saratoga County for the Office for the Aging. The Office for the Aging provides a number of services for the county. Everything for seniors, everything from legal services to, you all know probably about Meals on Wheels and other services around the county. But one of the services offered is actually Medicare Counseling. I'll talk a little bit more about it at the end and how you can get into a more in-depth counseling session if you're interested. But we also do talks like this. I was mentioning to Chris, I did a talk yesterday to the Malta seniors. So we do talks. If anybody's interested in having a talk to a group of people, we can do that also. But today we're doing a little one-on-one session kind of through Zoom. Like I said, we'll deal with questions at the end. This won't take too long to go through the actual presentation. Hopefully not more than 20 minutes at most. So we'll have quite a bit of time at the end for questions. So please feel free to ask questions when we get to the end, and we can jump out of the presentation and do some other things if you're interested. But I will just get started now. Most people, when we, whoops, I got to get my, oh, there we go, a little delay. So when we're counseling people, I usually use this slide as an introduction to provide people with an overview of Medicare. Most people, when they're first introduced to Medicare, have very little idea. Some people have done some research, but most people that we actually deal with are totally confused. And even more confusing, they see all these commercials on TV. They get all these ads in the mail. And I typically tell everybody, ignore what they see on TV, ignore all the mail that you're getting, because you're probably getting only a portion of the story. Mostly what they're talking about by these companies is what they sell. But if they don't sell certain products, they obviously won't talk about them. So we tend to tell everybody, ignore the advertising that you actually see. But this is the overview we start with when we do counseling with people. We generally say with Medicare, there's three general approaches to getting your Medicare coverage. Many people in the country have what's referred to as original Medicare, and we'll talk about that. That's up in the upper left-hand corner. But then there's two ways to add additional coverage to original Medicare. You can buy what's referred to as a Medigap plan, or you can actually buy into a Medicare Advantage plan, and you'll see those terms being used on TV. So I'll talk a little bit about that. With original Medicare, a number of years ago was divided into several parts. And the reason why these parts have letters is because Medicare actually evolved over time. It wasn't like 10 years ago, the federal government just created Medicare. It actually, these different parts were added over different parts of time. So that's why it tends to be even more confusing. But when people sign up for Medicare, they usually start with Part A. Part A covers mainly admitted hospital stays, being admitted to the hospital. Most people don't have to pay anything for Part A because that's what you've been paying out of your payroll taxes for years with Medicare is to pay for Part A. So most people don't pay a monthly premium for Part A. If they have Part A, if they're being admitted to the hospital, there's what they call a $1,484 deductible per hospital stay. That's not per year. It's not per day. It's how Medicare defines a stay. And Medicare defines a stay as you can be in and out of the hospital as many times as you want for even different conditions. And as long as that's all within 60 days, that's considered one hospital stay. So with original Medicare Part A stay is defined as a 60-day period of time, and your cost for that stay would be $1,484 for the stay. Part A also covers skilled nursing care or skilled nursing facilities. It also covers hospice care, but generally we talk about it being an admission to an actual hospital. Part B covers many other medical services. It covers your doctor office visits. It covers emergency rooms. It covers outpatient because you're not actually admitted. Scans, x-rays, blood work, all these things are covered under Part B. Most people pay a premium for Part B. This year, the premium that most people pay is $148.50 a month. That's estimated. We don't have an exact number yet, but that's estimated next year to go to about $158 a month. So probably about a $10 increase. Sometime over the next month, everybody will hear what that actually is. So most people pay that. People that are relatively high incomes may pay more. Generally, if you're married and your joint income is above $175,000, you might pay more. Or if you're single and your income is above about $86,000, you might pay more. And people with very low incomes might not have to pay that. But most people that we deal with actually pay the $148.50 a month. Part B, if you do use Part B services, there's actually a $203 deductible per year at the beginning of the year. Once you've met that $203 deductible, say if you have an x-ray done and you pay $203 as your portion of your cost for that x-ray, after you've met that deductible, Medicare pays 80% of the Part B costs, and you're responsible for 20% of the costs. So when we talk about original Medicare, that's what we're talking about, those separate parts, Part A and Part B. You'll notice neither of those parts covered prescription drugs. So people with the original Medicare also have to buy a separate prescription drug program, which is referred to as Part D. The prescription drug plans are sold by private companies. They range in our area, they range in price from $10 a month to $90 a month, depending on how the company priced it. The companies can decide what drugs they want to cover within certain limits, but they're sold by private companies. So there are people with original Medicare, and there's many people in the country, that's the coverage they currently have, just Part A, Part B, and a drug plan, because that's all that existed for a long period of time. So some of our older seniors, that's what they still have for coverage because they never added anything beyond those original parts. One way of adding additional coverage, and the biggest issue with the original Medicare is under Part B, that 20% coinsurance. While it's great that Medicare pays 80% of Part B costs, you're responsible for 20%, and there's no cap on that 20%. So that lack of a cap on the 20% of Part B costs really causes most people that we counsel to look for additional coverage. They really want some additional coverage. And as I mentioned, one way of getting that is a Medigap plan. The other way is a Medicare Advantage plan. Medigap plans are conceptually pretty simple. Medigap plans are really like buying financial insurance. And you buy the Medigap plans from private companies, and all they do is help you pay the costs you would be responsible for under Part A and Part B. They don't add other benefits. They don't add other services. Medigap plans basically just help you pay the $203 deductible that you see under Part B, the 20% coinsurance there, the $1,484 under Part A. There's some other costs that aren't mentioned on this chart. We simplified this chart, but Medigap plans basically just help you pay those costs you would be responsible for with Part A and Part B. Medigap plans are great for many people. The biggest issue with Medigap plans is they tend to be expensive. In our area, in the Capital District, most of all the companies in our area, the Medigap plans typically range in price from about $155 to about $200 a month. So the Medigap plans are great, and we'll talk about the benefits and negative sides of it in a little while, but they are relatively expensive. So for some people who go that route, they're paying $148.50 a month for their Part B premium. They've bought a prescription drug plan for maybe $20, $30, $40 a month. And if they buy a Medigap plan, they could be paying another $200 a month on top of that. So it gets fairly expensive if you go that route, but it is great coverage. And there's a reason why some people prefer that coverage. And we'll talk about that in a little while. The other option to augmenting your original Medicare is instead to buy a Medicare Advantage plan. You can't do both. You can't do a Medigap plan and a Medicare Advantage plan. It's either or. Medicare Advantage plans are an entirely different way of getting your Medicare coverage. What happens with Medicare Advantage plans, essentially Medicare contracts with companies to take care of your health insurance. And you'll see all the advertising on TV. It's the Humanas, the United Healthcare, CDPHP, MVP, the Blue Shields. They all offer Medicare Advantage plans in our area. They're great in that they also cover prescription drugs. So you're dealing with one company for everything. They cover prescription drugs. They typically have low or actually no monthly premiums. There are some very good plans in our area that you don't pay any additional premium besides the $148.50 for Part B. But while some services are free, you do pay a copay for most services with a Medicare Advantage plan. There are some services that are free, but you do pay. Typically, you pay copays for most services. All the Medicare Advantage plans also have the concept of participating providers. So they're participating doctors, participating hospitals. All the Medicare Advantage plans have that. Some Medicare Advantage plans expect you to go to their participating doctors. Other Medicare Advantage plans, you can go to doctors outside their network. You would just pay more to do that. So there are Medicare Advantage plans in which you can go outside their network. It just is usually a little more expensive if you choose to go that route. So there's a wide variety of Medicare Advantage plans in our area. There's about 58, I believe, Medicare Advantage plans you can choose from. So they're very different. And we'll talk about the advantages and we'll talk about in a few slides why some people choose Medigap plans and why some people choose a Medicare Advantage plan. One thing about Medicare generally is that whether you go original Medicare or a Medicare Advantage plan, we always like to let people know that there are a number of preventive services that Medicare covers. Some of these services are free for everybody. For instance, if you have colonoscopies or mammograms done within the regular number of years that are determined by Medicare, they're typically free services. There are other services such as the diabetes screening you have to be at risk for it to be free. So some of these services are free for everybody. Some of the services are free if you're at risk for a particular service. But it's always important to understand when you're dealing with especially your primary, if they say it's time to have a colonoscopy or a mammogram and you're anywhere in Medicare, to make sure that if it's done, like I said, within the normal number of years of screenings, that you shouldn't have to pay for that, because that we have found some facilities that do charge people or try to charge people for a number of these services. So it's always worth checking with your doctor if you are going for any type of screenings or other types of scans to make sure that if it's supposed to be free for you on Medicare, that it is free. Many people are surprised when they get on Medicare that original Medicare does not cover certain things. Doesn't cover long-term care, doesn't cover routine dental care, doesn't cover vision, doesn't cover dentures or any cosmetic surgery or procedures, and actually no coverage of hearing aids. That's with original Medicare. And this is true for the Medigap plans also. Remember, Medigap plans, all they do is help you pay for your costs. They don't add additional benefits. They just help pay your costs. So if original Medicare doesn't cover it, your Medigap plan isn't going to cover it either. But that's the current discussion that was going on that everybody probably heard about over the last few weeks with Congress. as to whether vision and dental and hearing should be added to Medicare, but original Medicare does not cover these services. With Medicare Advantage plans, and this is where you see a lot of the advertising on TV, Medicare Advantage plans are allowed to offer additional services beyond original Medicare. So you'll find many of the Medicare Advantage plans that now offer some services or benefits for routine dental, vision, or hearing. We always make sure people understand it's not vision or dental insurance. For instance, with dental, the plan might help pay for your exam, might help pay for an x-ray, but it's not, most plans at this point are not paying for anything restorative like fillings or crowns. They're basically routine coverage for vision and dental. We do notice every year, and even for next year, when looking at the plans, they are starting to add a little more coverage. So there are a couple of plans that are starting to add a little bit of coverage towards doing fillings, dental fillings. So they are adding a little more benefits every year. That seems that every year that we tell, even the existing, like saying I was talking to the Malta seniors yesterday, and they all have some type of coverage, but it's important for people to look at their changes every year because these plans are adding a few more services every year. So it's important to know that if there's a new service that they could take advantage of, that they understand that. Many of the plans now offer Silver Sneakers. Silver Sneakers is a program that you can go to the Y for free, or many of the gyms in our area for free. Many of the Medicare Advantage plans offer that. They offer health classes. Some of the Medicare Advantage plans actually provide financial support. They might give you $50 every 3 months or $100 every 3 months to actually buy over-the-counter drugs and supplies beyond prescription drugs. And for the first time next year, we're seeing some plans actually offer transportation. So they might pay for a few visits a year to your doctor, for you to get transported to your doctor or to the hospital. So these Medicare Advantage plans are adding a little more services. They do vary by company and even by plan, because you could be in one plan in a company that offers transportation and another plan that doesn't offer transportation. So we are seeing a few more benefits every year with the Medicare Advantage plans. I want to come back, slide back to the Medigap insurance again. Remember, Medigap insurance are the plans that help you pay your copays and deductibles for A and B. Two important things to note about Medigap, the Medigap plans. We'll see it more strikingly on the next slide, but the premiums, the monthly premiums you pay for Medigap plans vary significantly by company. And I'll talk about that on the next slide. The other important thing to know about Medigap plans is in New York State, that's not true for all states, but in New York State, you can enroll in or change your Medigap plan any time of the year, as many times as you like. So if you have a Medigap plan and your company increases your premium significantly, you can, any time of the year, you can switch to another company and get a Medigap plan from another company. But it's important to know that, though, because unfortunately, what we see is some people just stay with the same company, stay with the same Medigap plans. They've had a number of premium increases over the last 5 years, and they're paying much more than they should if they'd switch to a different company. So it's important to note that the premiums do vary significantly, and you can, at least in New York State, if you're a New York State resident, you can change your Medigap plan whenever you would like. To give you an idea of how much variation there is in pricing on Medigap plans, the New York State Department of Financial Services actually maintains a website at which you can get the current pricing as of the beginning of every month. So this is right off of the New York State website as of October 1st. And I put my zip code in there, but you would see the same pricing for all the zip codes in Saratoga County. It doesn't vary by zip code. Our entire area, the pricing looks like this. What you see down the left-hand side are all the different companies that offer Medigap plans in our area, everything from Aetna down to United Healthcare. The columns represent the different types of Medigap plans you can buy. What Medicare did was structure the Medigap plans in terms of letters. and the letters denote how much coverage you have. So for instance, a Plan F, which you'll see in the 5th column, if you go down Plan F, a company that sells a Plan F, you would have no copays for any Part A or Part B services. A Plan F, you have no copays at all. It covers all the costs and deductibles you would be responsible for under Part A or Part B. A Plan G, however, covers virtually everything except, might not remember, I mentioned under Part B, there's a $203 deductible at the beginning of the year. That's the only thing Plan G doesn't cover, is that $203 deductible at the beginning of the year. So the letter denotes the amount of coverage you have. So all these different columns represents different levels of coverage in terms of what services are covered under Part A and Part B. And you can see the pricing. So if you look down even just the Plan F column, you can see that one company, Bankers Conseco, is offering a Plan F in our area for $514.08, whereas you can get exactly the same Plan F for exactly the same company for exactly the same coverage for $216 from Transamerica. It's exactly the same coverage, but it's less than half the price. So if you do decide to go the Medigap route, it's very important to realize that pricing varies significantly. If Medicare really monitors this, it mandates that if they offer a Plan F or they offer a Plan G or they offer a Plan N, the coverage is the same across the country. The only thing that can vary is the price. But unfortunately, people don't know this website exists. They don't know they can go to this website and see what the current pricing is. Like I said, some people have had fairly significant price increases with their Medigap plans the last few years, and they kept paying those increases. And in New York State, they could have changed to a different company whenever they chose to. So it is important to be aware of and understand that pricing exists on these Medigap plans. The plans we usually talk about, because this gets complicated and we don't see a big variation among these different companies, one of the things we do when we're talking to people, we usually, to get a Plan F, Medicare made a change a couple of years ago. To have Plan F, you had to turn 65 before January of 2020. So if you turned 65 before January of 2020, you can still get a Plan F. If you did not, the most comprehensive plan you can currently get is a Plan G. And again, the Plan G covers all of your Part A and Part B costs, except for that $203 deductible at the beginning of the year. The comparison we usually do for people is a Plan G versus a Plan N. If you looked at it, I can at the end, I can show you if you want to see the details of these different plans. But we usually do talk about a Plan G versus Plan N for people. Like I said, Plan N also does not cover that $203 deductible. But with the Plan N, the other costs you would be liable for is up to a $20 visit to a cost if you visited a doctor. So the only real difference between G and N is that with N, you might pay $20 for an office visit. You might not. Some doctors don't charge it. And you might pay $50 for an emergency room visit. Otherwise, Plan G and N are essentially the same. So usually when we get into this type of discussion with people, we talk about, well, how many doctor office visits are you going to make a year? There's potentially a $30, $40 difference between the least expensive Plan G and a Plan N. Or are you going to make 2 doctor visits a month? Probably not. Then maybe the Plan N is a better choice. So when we're counseling people, we get into that kind of a discussion with them if they're interested in Medigap plans, how many doctor office visits they might have. They might be subject to $20 doctor office visit if they had a Plan N, but we know there are a number of people that don't even get charged that. So that's generally Medigap plans a little bit. We can obviously go into much more detail about them if anybody's interested at the end. So the most common question I receive from people is, well, what should I get? Should I get a Medigap plan or should I have a Medicare Advantage plan? And my answer is it depends. It depends on a number of factors. It depends on your financial situation. It depends on your health, and it depends on your lifestyle. So just to summarize some of the key differences, as I mentioned up front, the Medigap plans do have higher monthly premiums. We were just looking at some of those premiums. The Medigap plans are more expensive, but for that price you're paying in a monthly premium, you'll see virtually no or very small copays for services. Like I said, if you bought a Plan G, you'd pay that $203 deductible for the year. Even if you went to a Plan N, you might pay also on top of that $20 for doctor office visits, but that's it. Most of your other Part A and Part B costs would be covered. So Medigap plans, high monthly premiums, smaller no copays for services. The Medicare Advantage plans are somewhat the opposite. They have very low or no monthly premiums. So like I said, there's some plans in our area where they don't charge you anything. But while some services are free with the Medicare Advantage plan, you do pay a copay for most services. We do see people requiring fewer health services, usually gravitating towards the Medicare Advantage plans. People with some more serious illnesses, especially very serious chronic illnesses, where they might really require a lot of services or very expensive services under the Medicare Advantage plans, might go towards a Medigap plan. Not that they're going to get better health, but it might be even though they're paying a higher monthly premium, it might be less expensive for them than the Medicare Advantage plan if they require a lot of services. With the Medigap plans, there's no concept of participating doctors. Any doctor or facility in the country who accepts Medicare will accept your Medigap plan, any of those Medigap plans. If you're on, if they accept Medicare, they have to take your Medigap plan. Whereas we mentioned the Medicare Advantage plans, there's this concept of participation. You typically have to visit the doctors or facilities in the plan. Some plans that are referred to as PPOs, as I said, you can go out of network. And the most important thing is with the Medicare Advantage plans, they are required to cover emergency treatment anywhere in the country. So even if you're outside of their service area and you're in California, and you break a leg and you go to the ER, all the Medicare Advantage plans are required to cover that. So they do have to cover emergency treatment anywhere in the country for the Medicare Advantage plans. Again, with the nice thing about Medigap, the Medicare Advantage plans, the Medicare Advantage plans do include prescription drug coverage. You don't have to buy a separate drug plan. But with the Medigap plans, you do need to buy a separate drug plan. That's something you have to also buy from a private company. So this is the kind of, when we're counseling, this is basically the discussion we have with people. What's their lifestyle like? Do they plan on spending significant amount of time in the year outside of a particular service area? If they are, they might be better off with a Medigap plan. The financial, but many people look at the pricing in the Medigap plans, quite frankly, and say they don't want to pay that. They don't want to pay $150, $200 a month for a Medigap plan. So there's reasons why people choose one or the other of these plans. We are right now in the middle of what's referred to as the open enrollment period. Every year from October 15th through December 7th, you can change anything I just talked about. You can change from original Medicare with a Medigap plan to Medicare Advantage or back and forth. Any changes you make would be effective January 1st. We do counseling all year long. Some of it's in person. We weren't doing it in person until about a month and a half ago, but we started in-person counseling again. Some of it's over the phone. We do some counseling over the phone. Sometimes we do Zoom counseling with people. So if you're interested in a counseling session, just call the phone number there and they'll get you scheduled for a counseling session. There's myself and one maybe sometimes another person that will do the counseling. The office staff and the Office for the Aging will answer a number of questions over the phone, but if they think you really are interested in a more in-depth discussion, what we do is we go through your prescription drugs. We can enter your prescription drugs into the Medicare.gov website, find out what your pricing for your drugs would be under the different plans. We start from the high level with, well, are you interested in this Medigap or Medicare Advantage? And we drill right down to comparing individual plans for people if they want to go into that level of depth. For people who have Medicare Advantage plans, and one of the things I should have said up front is that there are a number of times during the year, especially in New York State, where you can change your Medicare coverage. We tend to think about open enrollment, which I just thought about, but for people with Medicare Advantage plans, there's a different time, and basically in the first quarter of every year, from January to March, you can change from one Medicare Advantage plan to another, or even go back to original Medicare with a Medigap plan if you choose to. So besides open enrollment, there's a period of time from January through March where you can also change your Medicare Advantage plan. The other opportunity you have for changing is, it's noted at the bottom of the screen, Medicare rates all the Medicare Advantage plans. They're rated up to 5 stars. Prior to 2 years ago, we did not have any 5-star plans in our area. But as of right now, as of next year, all of the CDPHP plans are 5-star plans, and Blue Shield actually has 3 5-star plans. You have the option any time of the year of changing to one of these 5-star plans if you need to. It's one of the things Medicare added a couple of years ago, is that you're given, besides open enrollment, beside this period from January to March, if you're in one of these other companies and one of their plans and you want to change your Medicare Advantage plan and it's July, you can change to one of the 5-star plans if you choose to. You get one change like that during the year. So there are a number of times during the year when changes can be made. Many people, quite frankly, once they get their Medicare and health insurance settled, they don't want to think about it again. They never want to have to deal with this again or think about it. But we do encourage people to pay attention to their premiums, pay attention to what they're paying every month, look at the changes in your plans. There may be new services, like I mentioned in the beginning, that you can now take advantage of that weren't there last year. Or the pricing changes significantly, and it's important to know that you can change. There are many opportunities to change during the year. We added this slide because we are seeing a number of insurance agents, and there are brokers who sell plans for a number of companies, quite frankly, that are being more aggressive. Medicare does not like these companies being aggressive. The advertising on TV and the mailings you get are okay. But basically, as it says on this slide, the brokers are not allowed to say they're from Medicare. They're not allowed to go door to door, leaving materials at your door. They're not supposed to text you or even call you and leave voice messages. They're basically not supposed to be able to contact you unsolicited. If you've given them permission, if you have expressly given them permission, or you've already obviously enrolled in the plan and they're following up on that discussion, or if you did go to one of their sales events or marketing events and you expressly gave them permission to contact you, it's okay for them to contact you. But they are not supposed to be making cold calls to people, contacting you through text or email. We're quite frankly trying to track down a couple. We found that some of our clients have had these cold calls, and we're trying to track some of that down to see what company is doing it. But it's something that Medicare has tried to control, the very aggressive marketing, besides all the TV commercials and the mailings that you get all the time. One thing we recommend everybody in New York State, is join Epic. Epic is a New York State program. It's not a drug plan. It's a program that helps pay, New York State program that helps pay drug costs. It can help lower your prescription drug copays if you have expensive drugs. to be eligible, you must be 65 years old. You have to be New York State eligible, a New York State resident. And if you're eligible, if your income is, I'm sorry, I'm jumping. If your income is less than 75,000, or you're married and your income is less than 100,000. If that's true, you're eligible for EPIC. And what's EPIC do for people? Trying to get my screen has frozen on me. That's interesting. Let's do that. Okay. There are two parts of the EPIC program. EPIC has something called a fee plan, and they have something called a deductible plan. The fee plan is for people who are single with incomes below 20,000, or as you see, married in 26,000. People who are in the fee plan actually pay a small quarterly fee. It's not very much. It's like $100-some for the whole year, but they pay a small quarterly fee. But if they're eligible for that fee plan, EPIC helps them pay their drug co-pays immediately throughout the entire year. It's on a sliding scale, but you could have a drug that normally would have a copay of $100. And if EPIC is helping you, you might not pay more than $20 copay for that drug. So the EPIC program helps, the EPIC copays help significantly. The other thing is called a deductible plan. If your income is above those levels, people are in what's referred to as the deductible plan. And what happened is, based on your income, you're given a dollar amount from EPIC. And if you ever spend that dollar amount in the year on your drug copays, EPIC would help you pay your prescription drugs for the rest of the year. So you might get, like you say, you get a deductible number from EPIC. If your drug copays you paid ever reach that, EPIC would help you for the rest of the year. The great thing about the deductible plan is it's free. So, like I said, for most people, we encourage them just to join EPIC. It doesn't cost anything, especially if you're in the deductible plan. Even if you don't think you're ever going to reach the deductible number they give you, it's worth, we try to tell people, hopefully you never get expensive drugs, but it's amazing how expensive some of the prescription drugs are these days, and EPIC can help pay for those. The other thing EPIC does help with is, just for being an EPIC member, you get, again, this concept of you can change. EPIC allows you to change your drug plan one other time a year. So just for being an EPIC member, you get one other time a year that you can change your drug plan besides the periods we already talked about. So we encourage everybody to join EPIC. Most people are in the deductible plan. It doesn't cost anything to be in the deductible plan. And it's good to just have that in place. Medicare does have a website called medicare.gov. You can go to that website to compare plans. You can compare the drug plans. You can compare Medicare Advantage plans. That's the website we actually use as counselors. We don't have any proprietary software that we use. We actually use the medicare.gov plan finder. If anybody wants to, I can give you a quick little demo of that at the end. If anybody wants to see how it works, it's open to the public. Anybody can use that website to compare drug plans or to compare Medicare Advantage plans. They really don't have much information on the Medigap plans. It's mostly for drug plans and Medicare Advantage plans. And finally, again, just to wrap up, we do counseling sessions all year round. We do it over the phone, we do Zoom with people, we do it in person now. Just call the Office for the Aging. If you are interested, they will actually ask you to submit a form with some basic information, so that we have that going into the call. They'll ask you about your prescription drugs. They'll ask you a few other basic questions, but they'll ask you to submit that form, then they'll schedule you for a counseling session.